I'm Dr. Mihaela Alexander. I'm a neurologist in Littleton, Colorado. I'm also the neurologist that's been managing Anki's Parkinson's disease for the past several years. Anki is one of the many Americans that was diagnosed with Parkinson's disease at a young age, in her 50s. Very young and physically and socially active. Parkinson's disease has taken a toll. In Anki, it presented as in a lot of typical Americans affected with Parkinson's disease, with significant tremors on the left side, rigidity, stiffness, slowness of movement that interfered with her activities of daily living and her social life and her work. She had trouble with motor fluctuations and medications and side effects. We decided, since she was only in the 50s when she was affected, to proceed with an alternative form of therapy called deep brain stimulation therapy. We found that Anki was an excellent candidate, as she's a young patient, healthy, with intact intellectual function, with significant disabling motor fluctuations and tremors and abnormal slowness of gait. That should be a great candidate for this form of therapy. And fortunately, Anki went through surgery, implantation of the leads in the brain, and implantation of the neurostimulator really well. And I think she is a living testimony that this form of therapy helped her a lot. Parkinson's disease is a very common neurodegenerative disorder. We see it in about 200 to 300 out of 100,000 Americans. Unfortunately, only a small number of these patients, even those who are moderately to severe affected with a lot of disability, get referred from this form of therapy. And with patients like Anki, who did really well and who are also great advocates for patients with Parkinson's disease, we hope to get the word out that there is a, beyond medications, there is an alternative form of treatment that it's very, very effective. As a matter of fact, Anki can demonstrate that she's doing really well. She's taking no medications at the present time. She has great mobility. She rarely has slight tremors in her left hand. I think overall the quality of her life has improved greatly and has given her a lot of hope and motivation to remain physically and socially active and to do the things that she's doing today, selflessly promoting care and referral for other patients with Parkinson's disease, and educating patients with Parkinson's disease and families in the United States to try to seek an opinion from a neurologist or neurosurgeon who is trained in this form of therapy. So somebody else will have the opportunity to go through this procedure and have a much better quality of life. Even in the most severely affected patients that have severe disabling dyskinesias or severe off-time and freezing episodes, the quality of that one time when patients feel well and they have good mobility increases on average 7 hours a day. Patients reduce the number of medications that take. Anki is very fortunate. She takes no medications at the present time, but overall patients take less medications. I will not go through the whole process, but deep brain stimulation therapy involves the placement of electrodes in the brain, in two areas of the brain called subthalamic nuclei. By continuous stimulation, it does regulate the mobility and the motor function of the patients with Parkinson's disease. These leads are connected to a pulse generator or a neurostimulator that it looks like this. This is very similar to what Anki has, placed in her upper chest area under the clavicle. And once the leads are placed in the brain and the neurostimulator is implanted, we use a small handheld computer, and via telemetry we do programming of the neurostimulator, and we adjust several parameters. We choose a certain location of anodes and cathodes, and we also manipulate amplitude, rate, and pulse width, and via this handheld computer that will, so to speak, talk to the implantable neurostimulator, and we make changes depending on each patient's symptoms and examination. We adjust the stimulation just as we adjust the dosage of medications, and it's sort of custom. It's based on each patient presence in my office and the symptoms that they have and what we find on examination. We adjust the stimulation to correct certain abnormalities in the examination to increase functionality and get as close to a normal function as we possibly can. I think Anki, along with many of our other patients with Parkinson's disease who have this form of therapy, deep brain stimulation, is very happy. She thinks it's made a difference in her life, and the quality of her life has significantly improved. And I heard from her what I heard from numerous other patients. I wish I would have done it sooner. Thank you very much.